Lesson number 5, Radiotherapy. By the end of this lesson, you should be able to explain the application of radiation in treating malignant tumors, and explain that radiation treatment does not always lead to a cure, and that it is sometimes used to reduce suffering. There are many different types of cancer, all caused by abnormal cell growth. Normally, cell division is carefully controlled, but with cancer, the cells start dividing in an uncontrolled way. This can result in a lump of rapidly dividing cells called a malignant tumor. Some malignant tumors spread around the body, circulating in the blood or lymph vessels. Benign tumors are not cancerous. They can stay in one place and do not harm surrounding tissues, except by pressing on them. Radiotherapy can be used to treat or control cancer. Radiotherapy uses gamma rays, particles such as electrons, or more commonly, a beam of high-energy X-rays. Electron beams do not penetrate well, so can be used to treat skin cancer. X-rays have a higher energy, so can penetrate tissues more easily and travel further. They can be used to treat a tumor inside the body. The aim of radiotherapy is to destroy cancer cells while keeping any damage to healthy cells to a minimum. Carefully targeted, measured doses of radiation can be used for a range of conditions, including thyroid disorders and blood diseases, as well as cancers. Radiotherapy is used on its own to treat thyroid cancer and some brain tumors. For other conditions, it can be used together with surgery to reduce the size of the tumor before it is removed, or after an operation to make sure all the cancerous cells are destroyed. It can also be used with chemotherapy. Although radiotherapy can be given on a single occasion, it is usually given in several small doses over a period of days or weeks. Our bodies are made up of cells which divide to make new cells for growth or repair. If radiation hits a cell that is dividing, it might be damaged. Cancer cells are more likely to be dividing and are much less able than normal cells to repair the damage. So cancer cells are damaged much more by radiotherapy than normal cells. Any healthy cells which are affected are quickly replaced by normal cells. The beams are focused to ensure that the target area, rather than healthy cells, receives the most radiation. One approach is to direct the rays from different directions. The cancer is hit by every beam, but healthy tissue is only exposed to one beam that passes through. Some treatments cannot destroy the cancer. Instead, radiotherapy is intended to control the symptoms of cancer. This is known as palliative care. The radiotherapy might be used to shrink a tumor which is producing pressure, causing a blockage or causing compression on the spinal cord. This approach is also used on tumors which have grown under the skin and have produced wounds. The radiotherapy can shrink the tumor, stopping any discharge or bleeding.